Newcastle's really set the mark and defies all the wild hysteria. In the mid-2000s, we had the highest level of alcohol-related assaults. If we roll forward to today, research shows that in the last 9 years, there's been a sustained 72% reduction in weekend night assaults. In very practical terms, that means more than 6,000 young people have been prevented from being assaulted on our streets.
Restriction in trading hours in Newcastle provide good evidence for the effects of restricting trading hours on the incidence of assault. The same is true for Sydney. Large reductions in assault in King's Cross and the CBD after restrictions in trading hours. There was a good example in Newcastle in 2008 when the community and the police independently made complaints about extreme levels of violence and antisocial behaviour in the central business district of Newcastle. In New South Wales at that time, that ruled that those outlets, the pubs in the CBD of Newcastle, had to close earlier. So instead of 5 a.m, they had to go to 3 a.m. With a 1 a.m. lockout. And that brought immediate reductions in alcohol-related assaults. So that's the consequence of police and community working together. So in the case of Newcastle, there was a person, Tony Brown, an advocate in the area who was skilled and persistent and has continued to make things happen.
I've always had a strong sense of social justice and social consciousness, and I had a young daughter at the time who was nowhere near drinking age, but many of my friends' children unfortunately were victims of violence in the Newcastle night economy. And it got to a terrible situation where most parents you spoke to in Newcastle who had children at the drinking age would go out. Nearly all of those parents, young males, had either been assaulted or definitely one of their friends had been assaulted. We had local residents who were experiencing, on a weekly basis, disturbance, the violence, the vandalism and the vomit. We had local doctors and local businesses. I was able to generate more than 150 residents complaining, and we formed a coalition called the Newcastle Inner City Residents, Small Businesses and Concerned Citizens.
And there have been various other parts of society that have been involved. There's civil society organisations, NGOs, the Foundation for Alcohol Research and Education, the Australian Drug Foundation, the Police Association, nurses, doctors, academics, various organisations who see the importance of doing something about alcohol have been involved and tried to lend support. But it's been led by the community, and I think that's part of the reason that it has succeeded.